Hi, good morning. My name is Jaira, so I will be your nurse for today. Before we start, may I know your name
Uh,
and first and last name?
my name is Kenneth Gajulis,
Okay, and your date of birth?
June 6, 1989.
Okay, I'm just gonna check your armband. Kenneth Kajulis, June 6th, 1989. Okay, all right. So I am here to do your physical assessment. So basically, I'm just gonna do just the head, the neck, and I'm just gonna check your hands as well. Okay. So first, I'm just gonna wash my hands. Okay, just gonna close the curtain. So I'm gonna do like a series of assessment. I'm gonna do inspection and then palpation. So that means I'm just gonna hold your head and try to check your neck and your hands. Is that okay with you? Okay, so do you have any questions before we start? All right, okay, so let's start. So first, let me see your hands, please. All right, I'm just gonna check for the pigmentation and I'm gonna check for the temperature, the moisture, the texture. Okay, so for your skin, it's smooth and it's firm, and I'm also gonna check the capillary refill. So it goes back within 2 seconds, and I'm just gonna check the skin turgor. So I'm just gonna try to do a little bit of a pinch in here, see if it goes back right away. All right, and also I'm just gonna check for let me see your hands again, for any signs of cyanosis. So there's no sign of cyanosis, and there's no lesion and no bruises. And I'm just gonna check the nails as well. So the angle of your nail bed is 160 degrees. All right. So next I'll be checking your hair and your scalp. So I'm just gonna inspect it and I'll palpate this as well. Okay. Just checking for any infestations, any lumps or bumps, any deformities. Is there any pain whenever I touch over here?
No.
Okay, so I don't see any lesions, no deformities as well. And the size of the head is normocephalic. So I'm gonna palpate the temporal artery, okay? And I'm gonna palpate the temporomandibular joint. Could you open your mouth for me, please? And then close it. Okay. So I don't feel any clicking. And then I'm gonna check the ears as well. All right. So there are no presence of any discharge, no lesions, and no bruises as well. All right. So now I'm gonna check your trachea. All right, it's right at the middle. All right. Okay, so now I will be checking for the sinuses. You feel any pain? No? So now I'm gonna check your nose. I'm gonna get you to cover one of the sides of your nose here, and then try to blow your nose. See if the air comes out. Okay, and then do the other side. All right, perfect. Next, I will be check the sinus. I'm gonna check if there's any deformity. Okay, so there's no deformity, no lesions, and everything's good. So next, I will be checking your mouth. So I'm gonna ask you to open your mouth for me. I'll just get my okay. I'm gonna get you to open your mouth. I'm just gonna check for the buccal mucosa, for the teeth, the gums, the tongue, this hard and soft palate. Okay, and you can close your mouth now. Okay, so next, I'm just gonna get you to open your mouth again. Just check the sides here. Okay, stick your tongue out a little bit. Alright, just gonna check the tonsils. Okay, all good? You can put your tongue in. Alright, so I don't see any presence of bleeding, and the mouth is moist, and there's no lesions, and there's no tooth decay, and there's no odor, and no bleeding. So next, I'm gonna be palpating your lymph nodes. Okay, so I'm gonna start with the pre-auricular, post-auricular, occipital, okay, submental, submandibular, tonsillar, superficial cervical, and deep cervical chains, and posterior cervical, and supraclavicular. And I'm just gonna get you to shrug a little bit. All right, thank you. All good. And I'm just gonna palpate your carotid pulse. All right. Okay, so that concludes your head, neck, and your skin and nails assessment. So do you have any questions after this?
No.
You're all good? Okay, thank you so much. I'm just gonna wash my hands. And then I'll document everything for the findings in the documentation. And that's it. So thank you so much, and you have a good day.